Performance. Imagine waking up each morning already bracing yourself for pain before your feet even touch the floor. The knees feel stiff, the back feels tight, and there's a quiet thought many older adults repeat to themselves: performance. This is just part of getting old. As a family doctor, I want to stop you right there because this belief is one of the most harmful myths in senior health. Joint pain is common with aging, yes, performance, but common does not mean normal, and it certainly does not mean something you should silently accept. Pain is not an age requirement. Pain is a signal, performance, and ignoring it often allows small problems to turn into life-limiting ones. From a medical perspective, aging alone does not automatically cause joints to hurt every day. What aging does is reduce the body's margin of safety. Performance. Cartilage may thin, muscles may weaken, and joint fluid may decrease slightly, but pain usually appears when something else joins the picture: chronic inflammation, poor movement patterns, muscle loss, excess weight, prolonged inactivity, or untreated medical conditions. When a patient tells me, "Doctor, it's just old age," I hear a warning sign, not a diagnosis. That statement often delays care, reduces mobility, independence. One of the biggest dangers of accepting joint pain as normal is delayed treatment. Many joint conditions respond best when addressed early. Mild arthritis, muscle imbalance, postural strain. For early inflammation can often be managed with simple lifestyle adjustments, targeted exercise, and medical guidance. When pain is ignored for months or years, joints stiffen, muscles weaken further, performance and movement becomes restricted. By the time help is finally sought, the problem has become harder to reverse. What could have been manageable becomes disabling. There's also a psychological cost to normalizing pain. Performance. Persistent discomfort slowly changes how people live. They stop walking as much, avoid stairs, sit longer, and withdraw from activities they once enjoyed. This reduction in movement accelerates muscle loss and joint stiffness, ferments, creating a cycle where pain feeds inactivity and inactivity feeds pain. Over time, confidence erodes. People begin to fear movement, not realizing that fear itself is worsening their condition. As a family doctor, performance, I see this pattern repeatedly, and it is one of the most preventable causes of decline in older adults. Another critical issue is that not all joint pain is caused by simple wear and tear. Conditions such as gout, rheumatoid arthritis, infections, nerve compression, and even fractures can present subtly in older adults. Pain that is persistent, worsening, associated with swelling, redness, warmth, performance, or sudden loss of function should never be dismissed. Assuming pain is just aging can allow serious, treatable conditions to progress unchecked. Early medical evaluation protects not only joints but overall health. Performance. There is also the issue of pain tolerance. Many seniors pride themselves on being strong and enduring discomfort quietly. While resilience is admirable, silence can be dangerous. Pain changes the nervous system over time. Performance, making it more sensitive and harder to control. What starts as occasional discomfort can turn into chronic pain that affects sleep, mood, balance, and mental health. Addressing pain early is not weakness, it is wisdom. Performance. From a clinical standpoint, one of the most empowering conversations I have with patients is helping them reframe pain. Instead of seeing it as an unavoidable consequence of age, we treat it as feedback. Performance. What movements aggravate it? What time of day is it worse? What improves it? This information guides safe, personalized solutions. When patients understand that pain has causes and answers, hope replaces resignation. Performance. Families also play a role here. When older adults complain of joint pain, responses like "that's normal at your age" are often meant to comfort, but they can unintentionally silence legitimate concerns. Encouraging evaluation, performance, gentle activity, and supportive care sends a far healthier message: your comfort matters and your mobility is worth protecting. As a family doctor, I want every older adult to hear this clearly: aging may change your joints, performance, but it does not sentence you to daily pain. Pain is not a badge of honor, and it is not something to endure quietly. It is a message asking to be understood. When you listen early and respond wisely, performance. Joints often respond with improved movement, reduced discomfort, and a better quality of life that lasts far longer than most people expect. Picture an older adult who says, "My joints are getting worse," performance. "So I should move less." It sounds logical, even protective, but medically it is one of the most damaging beliefs in aging. As a family doctor, I often explain that joints rarely fail on their own. Performance. What usually fails first are the muscles that are meant to protect them. Weak muscles quietly shift extra load onto joints, turning simple movements like standing, climbing stairs, or reaching overhead into painful tasks. Performance. This process happens slowly, which is why many people don't realize muscle loss is the real problem until joint pain dominates daily life. With age, the body naturally loses muscle mass and strength. Performance, a condition known as sarcopenia, after the age of 50, adults can lose up to 1% of muscle mass every year if no effort is made to maintain it. This loss accelerates with inactivity, illness, poor nutrition, performance, and chronic pain. Muscles act like shock absorbers and stabilizers for joints. When they weaken, joints are forced to absorb more impact and move with less control. Over time, this increased stress leads to inflammation, performance, stiffness, and pain, especially in the knees, hips, shoulders, and lower back. What many people don't realize is that muscle weakness does not always feel like weakness. It often shows up as fatigue, poor balance, Performance, difficulty getting out of a chair, slower walking, or the need to hold onto furniture for support. These signs are frequently dismissed as slowing down, when in reality they reflect a loss of joint protection. Performance. As muscles weaken, joints become unstable, and instability is one of the strongest drivers of pain. Another critical factor is that pain itself accelerates muscle loss. When a joint hurts, people instinctively avoid using it. Performance. This avoidance reduces muscle activation, leading to further weakening within weeks. The weaker the muscles become, the more painful the joint feels when it is eventually used. Performance. This vicious cycle is one of the most common reasons older adults lose mobility and independence. Breaking this cycle early is essential, and it requires understanding that strengthening, not resting, is usually the solution. From a medical standpoint, muscle strengthening in older adults does not mean heavy weights or aggressive workouts. It means safe, controlled, and consistent activation of muscles that support joints. Performance. Simple movements like sit to stand exercises, gentle resistance training, slow walking, and balance activities can significantly improve joint stability. Performance. Even small improvements in muscle strength can reduce pain because joints are no longer forced to compensate for weak support. Nutrition plays a major role in this process. Performance. Muscles require adequate protein and energy to maintain and repair themselves. Many older adults unintentionally undereat protein, especially at breakfast. Without enough building material, muscles shrink even faster. Activity level. Adequate hydration, vitamin D, and overall calorie intake also influence muscle health. From a family doctor's perspective, muscle weakness and joint pain are often signs of nutritional gaps. Performance, and not just aging. Fear is another barrier that worsens muscle loss. Many seniors are afraid that movement will damage their joints further. While certain movements may need modification, complete avoidance is almost never beneficial. Controlled, pain-aware exercise actually reduces joint stress by improving muscle coordination. When patients understand this, fear gives way to confidence, performance, and confidence restores movement. Balance and fall risk are closely tied to muscle strength. Weak leg and core muscles reduce stability, making falls more likely. Performance. A fall can instantly turn manageable joint pain into a serious injury. Strengthening muscles is not just about reducing pain, it is about preventing fractures, hospitalizations, and loss of independence. Performance. This is why family doctors emphasize muscle health as a cornerstone of healthy aging. Another overlooked aspect is posture. Weak muscles fail to maintain proper alignment, forcing joints into unnatural positions. Over time, performance. This leads to uneven wear and chronic discomfort. Strengthening postural muscles helps joints move as they were designed to move, reducing strain and fatigue throughout the day. Performance. One of the most encouraging truths I share with patients is that muscles respond at any age. Even people in their 70s, 80s, and beyond can rebuild strength with the right approach. Improvement may be gradual, performance, but it is real and measurable. Muscle is one of the few tissues in the body that can significantly regenerate when given the proper stimulus. As a family doctor, performance. I always remind my patients that joint pain is often a muscle problem wearing a joint label. Strength restores support, support reduces stress, and reduced stress allows joints to move with less pain. Performance. When older adults shift their focus from protecting joints by avoiding movement to protecting joints by strengthening muscles, the change in comfort, confidence, and independence can be profound. Performance. Many older adults are surprised when I tell them that joint pain often begins long before the joint itself shows significant damage. The real culprit in many cases is inflammation, quiet, persistent, and easy to overlook. Performance. It does not announce itself loudly at first. Instead, it creeps in as morning stiffness, a dull ache after sitting, or swelling that comes and goes. Because these changes feel gradual, people normalize them. As a family doctor, performance. This is one of the most dangerous misunderstandings I see, because chronic inflammation silently accelerates joint damage and makes pain far more difficult to control later. Inflammation is the body's natural defense system. In short bursts, it helps healing, but when inflammation becomes constant, it turns destructive. With aging, the body becomes more prone to low-grade, ongoing inflammation. Performance, sometimes referred to as inflammaging. This type of inflammation does not cause fever or obvious illness, but it steadily irritates joints, tendons, and surrounding tissues. Over time, it increases stiffness, reduces range of motion, and heightens pain sensitivity. Many patients assume this is simply wear and tear, when in reality it is a biochemical process that can often be modified. Performance. Diet is one of the strongest drivers of chronic inflammation, yet it is frequently underestimated. Diets high in refined carbohydrates, sugar, processed foods, and unhealthy fats push the body toward an inflammatory state. Performance. These foods trigger spikes in blood sugar and insulin, leading to increased production of inflammatory chemicals. In contrast, diets rich in vegetables, fruits, legumes, whole grains, healthy fats, fish, ferment, and natural spices provide antioxidants and anti-inflammatory compounds that help calm joint tissues. I have seen patients experience meaningful pain reduction simply by changing what they eat without adding new medications. Performance. Physical inactivity further fuels inflammation. When joints are not moved regularly, circulation slows and inflammatory substances accumulate in tissues. Movement acts like a natural anti-inflammatory pump, performance, improving blood flow and helping clear metabolic waste. This does not mean intense exercise. Gentle, regular activity is enough to lower inflammatory markers. Paradoxically, performance, avoiding movement because of pain often increases inflammation and stiffness, making joints feel worse over time. Sleep is another powerful but overlooked regulator of inflammation. Performance. A poor sleep quality increases inflammatory hormones and lowers pain tolerance. Many older adults struggle with fragmented sleep, frequent awakenings, or irregular sleep schedules. Over time, performance. This sleep disruption amplifies joint pain and stiffness, creating a cycle where pain interferes with sleep and poor sleep worsens pain. Improving sleep habits often leads to noticeable improvements in joint comfort, performance, even without changes in medication. Stress also plays a significant role. Chronic psychological stress triggers the release of cortisol and other hormones that, when persistently elevated, performance, promote inflammation rather than reduce it. Older adults dealing with loneliness, caregiving responsibilities, financial concerns, or health anxiety often experience heightened pain due to stress-driven inflammation. Performance, nothing emotional well-being is not separate from managing joint pain. It is part of it. Weight gain, even modest amounts, increases inflammatory activity in the body. Fat tissue is not just stored energy. Performance, it actively releases inflammatory substances. This means excess weight worsens joint inflammation, both mechanically and chemically. Weight reduction, even in small amounts, performance, can significantly lower inflammatory burden and improve joint pain. Hydration deserves attention as well. Dehydration thickens joint fluid and impairs the body's ability to flush out inflammatory byproducts. Performance, older adults are particularly prone to inadequate fluid intake due to reduced thirst sensation. Maintaining proper hydration supports joint lubrication and reduces stiffness. Performance, medications have their place in managing inflammation, but they are not the entire solution. Anti-inflammatory drugs can reduce symptoms, but without addressing underlying lifestyle factors, inflammation often returns. Performance. From a family doctor's perspective, the goal is always to reduce reliance on medication by lowering the sources of inflammation themselves. Performance. One of the most important messages I share with patients is that inflammation is not an inevitable consequence of aging. It is influenced daily by choices related to food, movement, sleep, stress, and body weight. Performance. When these factors are addressed together, the inflammatory load on joints can decrease significantly. Pain becomes more manageable, stiffness improves, and mobility often increases. Performance. Joint pain driven by inflammation is not a life sentence. It is a signal that the internal environment of the body needs adjustment. When inflammation is reduced, performance. Joints are given a chance to function with less irritation and more freedom of movement, even in later years. Many older adults believe that the safest response to joint pain is rest. When something hurts, performance. The instinct is to protect it by avoiding movement. This reaction feels sensible, even responsible, but as a family doctor, I can say with confidence that prolonged rest is one of the fastest ways to make joint pain worse. Performance. Joints are designed to move, and when they don't, they stiffen, weaken, and become more painful. The difference between movement that heals and movement that harms is not activity versus rest, but how the body is moved. Performance. Joints do not have a direct blood supply to their cartilage. Instead, they rely on movement to circulate joint fluid, which delivers nutrients and removes waste products. When movement stops, performance, cartilage becomes poorly nourished and less resilient. This is why stiffness is often worst after long periods of sitting or lying down, such as in the morning or after watching television. Gentle motion acts like lubrication. Performance. Restoring smoother, more comfortable movement. Fear plays a major role in inactivity. Many seniors worry that movement will wear out their joints faster or cause further damage. In reality, performance. Controlled and appropriate movement protects joints by strengthening the muscles that support them and improving coordination. The absence of movement allows muscles to weaken and joints to become unstable, increasing the risk of pain, falls, and injury. What harms joints is uncontrolled stress, not regular guided activity. The type of movement matters greatly. High impact or jerky motions can aggravate pain, but low impact performance. Rhythmic activities are often therapeutic. Walking, swimming, cycling, gentle stretching, and slow strengthening exercises improve circulation without overloading joints. Performance. Even simple daily movements such as standing up from a chair, reaching overhead, or climbing a few steps can serve as effective joint therapy when done mindfully. Consistency is far more important than intensity. Performance. Short bouts of movement spread throughout the day are more beneficial than occasional strenuous sessions. Joints respond best to regular use within a comfortable range of motion. Performance. Pushing through sharp pain or swelling is not helpful, but neither is waiting until pain completely disappears before moving. Performance. Learning to distinguish between discomfort that improves with motion and pain that signals injury is a valuable skill. Movement also has a powerful effect on pain perception. Performance. Physical activity stimulates the release of natural pain, relieving chemicals in the brain, and reduces sensitivity to discomfort over time. Performance. This means that movement not only improves joint mechanics, but also changes how pain is processed. Many patients are surprised to find that gentle activity reduces pain rather than increases it. Balance and coordination improve with movement as well. Inactivity dulls the nervous system's ability to respond quickly to changes in position, increasing fall risk. Regular movement sharpens reflexes. Performance strengthens stabilizing muscles and improves confidence. Confidence, in turn, encourages further movement, creating a positive cycle that supports independence. Posture and alignment are also influenced by movement habits. Performance, prolonged sitting shortens some muscles and weakens others, placing joints under uneven stress. Gentle stretching and strengthening help restore balance, allowing joints to move in a more natural and less painful way. Performance. Small improvements in posture can significantly reduce strain on the spine, hips, and knees. From a medical standpoint, movement is one of the most effective and safest treatments for chronic joint pain when properly guided. Unlike medication, it improves multiple systems at once: muscles, bones, balance, circulation, and mental health. It also empowers individuals' performance, giving them an active role in their own care rather than placing all responsibility on pills or procedures. Families and caregivers can support healthy movement by encouraging activity without pressure or criticism. Performance. Creating safe environments, offering companionship during walks, and celebrating small improvements help older adults stay engaged. The goal is not athletic performance, but functional movement that supports daily life. Performance. Joint pain often convinces people to shrink their world. Movement done wisely expands it again. Each step, stretch, and gentle effort sends a message to the body that it is still capable, still adaptable. Performance, and still worth caring for. Many older adults underestimate just how much their body weight affects joint health. A casual remark like, "I've put on a few pounds, it's no big deal," may seem harmless. Performance, but from a medical standpoint, every extra kilogram significantly increases stress on weight-bearing joints such as the knees, hips, and lower back. As a family doctor, I often see patients who are frustrated by joint pain and assume it is inevitable with age, unaware that even modest weight loss could dramatically reduce discomfort and improve mobility. Performance. The connection between weight and joint health is not linear, it is exponential. For example, every extra kilogram can add multiple kilograms of force to the knees with each step, multiplying the strain over a day, week, performance, and year. Excess weight affects joints in two ways: mechanically and biochemically. Mechanically, heavier bodies place increased pressure on cartilage, ligaments, and the joint capsule, accelerating wear and tear. Performance. This is particularly evident in the knees, where walking just 1 kilometer can generate forces several times a person's body weight across the joint. Over time, this repeated stress causes inflammation, stiffness, and pain. Performance. Many patients are unaware that small reductions in weight, 5 to 10% of body weight, can relieve a substantial portion of joint stress, often producing immediate improvements in comfort and function. Biochemically, excess fat tissue itself is metabolically active and produces inflammatory substances called cytokines. These chemicals travel throughout the body and increase chronic inflammation, contributing to joint pain, stiffness, performance, and swelling. Even with perfect movement patterns and strong muscles, inflammation from excess fat can accelerate degeneration. Performance? This means that weight management is not only about mechanical load, but also about reducing the chemical contributors to joint discomfort. Fear often prevents older adults from addressing weight as part of joint care. Performance. Many believe that reducing weight will be too difficult or that exercise will worsen joint pain. In reality, combining modest dietary changes with low-impact activities such as walking, swimming, cycling, performance, or gentle strength training is highly effective and safe. The goal is not rapid weight loss, but sustainable lifestyle adjustments that improve joint support, reduce inflammation, and enhance overall health. Even a small change, performance, like replacing sugary drinks with water, adding vegetables to meals, or walking 10 minutes after meals, can begin to produce noticeable benefits. Nutrition plays a complementary role in weight management and joint health. Performance. Protein is essential to maintain muscle mass, which protects joints, while balanced portions of healthy fats, complex carbohydrates, and fiber help regulate weight and reduce inflammation. Avoiding ultra-processed foods. Performance. Excessive sugar and refined carbohydrates further decreases inflammatory load, supporting both weight reduction and joint comfort. Hydration also matters, as water supports cartilage health and metabolic function. Performance. Making movement easier and reducing stiffness. Another key consideration is that weight affects posture, balance, and fall risk. Carrying extra pounds shifts the center of gravity. Performance, forcing joints to compensate and increasing the likelihood of injury during simple activities such as climbing stairs or bending. Strengthening muscles while reducing excess weight improves alignment, reduces compensatory stress on joints, and decreases the risk of falls, which can have devastating consequences for older adults. Mental and emotional factors often complicate weight management. Performance. Many seniors struggle with motivation, stress, or emotional eating, believing that lifestyle changes are too late to make a difference. From a family doctor's perspective, performance. Addressing mindset is as important as addressing diet or exercise. Setting realistic goals, celebrating small achievements, and fostering a supportive environment makes sustainable change possible at any age. Performance. Weight reduction is not a cosmetic goal, it is a therapeutic intervention. It enhances mobility, decreases pain, and slows joint degeneration. Patients who engage in gradual performance Consistent weight management often report that previously painful movements, climbing stairs, getting in and out of chairs, walking short distances, become easier, less exhausting, and even enjoyable. Performance. The impact is immediate and measurable, empowering older adults to reclaim daily activities and independence. Families and caregivers can support these efforts by creating a home environment conducive to healthy habits. Performance, stocking nutritious foods, encouraging gentle physical activity, and celebrating small but meaningful changes. The combination of reduced mechanical stress, decreased inflammation, improved muscle support, performance, and enhanced confidence dramatically improves quality of life. Excess weight may silently strain joints, but with knowledge, strategy, and support, its impact can be reduced. Performance, allowing older adults to move more freely and comfortably. Many older adults believe that persistent joint pain is simply something to live with. Performance, dismissing it as part of getting older. This mindset can be dangerous because early medical evaluation is one of the most important tools in preserving joint health and overall mobility. As a family doctor, performance. I often see patients who have endured months or even years of pain before seeking help, only to discover that much of it could have been managed or significantly reduced if addressed sooner. Performance. Persistent pain is rarely just a normal consequence of age. It is a signal from the body that something needs attention. Joint pain can result from a variety of causes, not all of which are related to wear and tear. Conditions such as osteoarthritis, rheumatoid arthritis, gout infections, bursitis, tendon injuries, nerve compression, or even fractures can present subtly in older adults. Performance symptoms may include swelling, warmth, redness, limited range of motion, or sudden episodes of sharp pain. Dismissing these symptoms as inevitable aging allows conditions to progress unchecked. Performance, sometimes resulting in irreversible damage. Early medical assessment ensures accurate diagnosis and timely intervention, which can prevent complications and improve long-term outcomes. Performance. Family doctors emphasize a comprehensive approach during evaluation. This includes a detailed history of the pain, physical examination, and when necessary, imaging or laboratory tests. Understanding the pattern of pain, form location triggers, timing, and intensity can reveal whether the problem is mechanical, inflammatory, or systemic. Laboratory tests can detect metabolic issues, autoimmune conditions, performance, or vitamin deficiencies that mimic joint disease. Imaging studies such as X-rays, MRI, or ultrasound provide insight into cartilage health, joint alignment, and soft tissue integrity. The goal is to identify not only the presence of joint damage, but also contributing factors that can be modified. Performance. Early evaluation is particularly important because many joint conditions respond best to intervention before severe damage occurs. For example, mild osteoarthritis can often be managed with lifestyle modifications. Performance. Strengthening exercises, physical therapy, weight management, and targeted medications. If addressed late, surgical interventions such as joint replacement may become necessary. Conditions like gout, rheumatoid arthritis, performance, or infections require prompt medical attention to prevent irreversible joint destruction or systemic complications. Early detection transforms what could be a chronic, debilitating problem into one that can be controlled, reduced, or sometimes reversed. Another critical aspect of seeking early evaluation is the prevention of secondary complications. Persistent pain often leads to reduced activity, muscle weakness, decreased balance, and diminished mobility. This inactivity increases the risk of falls, cardiovascular problems, obesity, and even depression. By identifying and treating joint issues early, older adults maintain mobility, independence, performance, and confidence, which significantly improves quality of life. In other words, addressing joint pain early has benefits that extend far beyond the joint itself. Fear, denial, and misconceptions often delay medical consultation. Some older adults worry about being prescribed surgery or strong medications. Performance, while others assume that nothing can be done for whole joints. Family doctors work to educate patients that early evaluation does not automatically mean invasive procedures. It is about understanding the cause of pain, performance, ruling out serious conditions, and creating a personalized plan that may include gentle exercise, nutritional adjustments, physical therapy, or medication when appropriate. Performance, early intervention empowers patients rather than limiting them. Families also play a crucial role in encouraging timely evaluation. Responses like "it's just age" or "you'll have to live with it" may inadvertently delay care. Performance, observing changes in mobility, function, or daily habits and supporting a medical assessment can prevent long-term consequences. Gentle encouragement, shared visits to the clinic, performance, and assistance with following a care plan reinforce the importance of addressing pain proactively. Early medical evaluation also fosters a mindset of proactive health management. Older adults learn to recognize warning signs, track progress, and make informed choices about activity, nutrition, and lifestyle. This approach reduces fear, improves adherence to treatment plans, performance, and builds confidence in one's ability to manage aging-related changes effectively. Persistent joint pain is a message, not a sentence. Responding to it with early evaluation allows identification of treatable conditions, performance, prevents progression, preserves mobility, and enhances overall health. Timely medical attention turns pain from a silent threat into an actionable signal. Performance, empowering older adults to take control of their joint health and maintain independence.